My name is Jane Etuge. My student ID D410809551. This is my physical assessment video for the NR 509. I am not using any aids, any assisted devices to complete this examination.
Hi, my name is Hajo Aite, and I permit this examination to be submitted to Chamberlain College of Nursing for grading purposes.
Okay, we're going to go ahead and proceed with a 360 view. For this exam. Okay. We're going to begin with inspecting our patient's head. We're looking for symmetry and midline, making sure there are no masses, no bulging in the head. Great. And our patient's skin, we're checking for lesions, any open sores or wounds in the face, which I do not see any. Did you have any pain or tenderness in your head?
No.
Okay. So our head is normal, cephalic, and no lesions or wounds were noted on the face. We'll go ahead and palpate for lymph nodes, beginning with the pre-auricular lymph nodes in the front of the ear, the post-auricular in the back of the ear, the tonsillar, the submandibular, the submental, the occipital, and the supraclavicle. Any pain or tenderness on palpation?
No.
Pain or tenderness. Okay. No pain or tenderness or bulging noted in this exam. We'll go ahead and test for cranial nerve number 5, which is a trigeminal nerve. This nerve has a motor and a sensory component to it. For the motor component, we're going to be palpating on the masseter muscles, and I'll ask my patient to clench down on her teeth. Great. Masseter muscle strength is good, so motor component is intact. For the sensory component, I'll have my patient close her eyes. I'll be touching you in several places of your face and just let me know where you can feel my touch. Okay?
Forehead.
Okay.
Both cheeks. Chin. Nose.
Cranial nerve number 5, the sensory aspect is intact. We'll move to cranial nerve number 7, which is the facial nerve. I'll have my patient perform a series of facial tasks. Okay, we're checking here for symmetry, making sure that all the muscles in the face and the nerves are working properly. Okay, puff your cheeks for me, give me a big smile. Go ahead and frown, raise your eyebrows, nice, and stick your tongue out. Great, and pucker your lips. Wonderful. Cranial nerve number 7, which is the facial nerve, is intact. We'll go ahead and inspect our patient's ears. We're looking at both ears for symmetry, making sure there are no other signs of drainage or redness in both ears, which I do not see any. We will go ahead with our otoscope and look into the internal ears, the internal ear canal, and we are checking for any redness. We'll pull the pinna up and backwards. We're checking for redness, swelling, any drainage, any effusion. The tympanic membrane is pearly gray, which is normal. No sign of infection that I can see. No cerumen left in the ear. We'll look on the other side. Up and back. I did not see any redness, no swelling noted, no sign of effusion, no sign of infection, no cerumen in the ear. The tympanic membrane is pearly gray. And now palpate on the pinna for any pain or tenderness. Anything?
No.
Any pain or tenderness on the tragus?
No.
Wonderful. So that is intact. We would go ahead and do the whisper test, which is cranial nerve number 8, which is the acoustic nerve. We'll be performing the whisper test, making sure hearing is intact in both ears. Go ahead and cover this ear for me, and I'll whisper a few words here. Just let me know what you hear.
1, 2, 3, 4.
Great. And the other side.
5, 6, 7, 8.
Great. So cranial nerve number 8, which is the acoustic nerve, is intact. We will go ahead and we're looking at a nose. We're assessing for midline, making sure it's straight, no form of deformities that I can see, no obvious signs of drainage or swelling. And with our otoscope, we're going to be inspecting the internal nasal cavity. I'll tilt your head back, and we're going to check for the nasal turbinate and the septum. I see no redness, no inflammations on the nasal turbinates, and the septum is not deviated in the right nostril. No drainage that I can see. And with the left nasal, no signs of redness. The nasal turbinates do not look inflamed. The septum does not look deviated. No signs of drainage or redness has been noted. Wonderful. While here, we're going to palpate the frontal and the maxillary sinuses. Any pain or tenderness here?
No.
Any pain or tenderness here?
No.
Good. Frontal and maxillary sinuses are normal as the patient does not have any pain or tenderness. Next, we're going to be inspecting our patient's eyes. We're checking its symmetry, no other signs of drainage, and the conjunctiva is pink and moist. The sclera is white. Do not see any redness noted in the sclera. We'll be checking for cranial nerve number 2, which is the optic nerve. We're checking for gross visual acuity, central and peripheral vision. With a Snellen chart, we're going to have our patient read. I will stand 6 feet away and read the lowest line possible you can see.
LTFPH.
Okay, cover one eye.
LTFPH.
Okay, on the other side.
LTFPH.
Great. Okay. Vision in both eyes is 20/70 bilaterally on the Snellen chart. Okay. And I'll have you stand. We're going to test for peripheral vision right here. Okay. Nice. I'm going to be moving my hands. Let me know at what point you can see my hands. Okay.
No.
Now. There.
No.
Okay. Good.
No.
Okay. Good. You can have a seat. Peripheral vision for optic nerve is intact. We will go ahead and test for cranial nerve number 3, which is the oculomotor nerve, cranial nerve number 4, which is the trochlear nerve, cranial nerve number 6, which is the abducens nerve, and we will be testing for oculomotor movements. Here we'll be using the H pattern to test for that. Okay. So, with your keep your eyes on my nose and follow my finger just with your eye. Okay. Great. Wonderful. Cranial nerve number 3, 4, and 6 are intact as the patient can perform all EMOs normally. While still on there, we're going to test for pupillary response using a light source. I'm going to flash a light in your eyes. Just keep your eyes on my nose, okay? Keep your eyes open. Wonderful. Great. Cranial nerve 3, 4, and 6 for pupillary response are intact as pupils are round, equal, and reactive in both eyes, about 2 to 3 millimeters bilaterally. Okay. Wonderful. We'll go ahead and we're inspecting our patient's mouth. We're looking at the patient's lips. They look moist, no signs of dryness. I'm going to have our patient open her mouth. We're inspecting the buccal cavity. Stick your tongue out. The posterior pharynx, I do not see any lymph nodes. At the back to great. The mouth is moist, it's pink. The tongue is moist and pink. Lift up your tongue. Great. It's pink and moist. The soft palate is pink and moist. No signs of gum disease. The teeth are straight and wonderful. Everything looks normal in that section. Okay. With the mouth still open, we're going to palpate the TMJ, the temporomandibular joint, for any supplication, crepitus, or tenderness. Go ahead and open your mouth. Close. Open and close. With any pain or tenderness?
No.
No. The patient does not have any pain or tenderness on palpation. We're testing for cranial nerve number 10, which is the vagus nerve. I'm going to have you say, ah. One more time. Great. Cranial nerve number 10 is intact as the patient's soft palate and uvula rises with formation. We will not be testing for the gag reflex with cranial nerve number 10. For cranial nerve number 12, I'll have you stick your tongue out, which is a hypoglossal nerve. Move it left to right. On the other side. Great. Cranial nerve number 12, hypoglossal nerve, is intact. Okay, we're going to move to inspect our patient's neck. The neck is midline, it's straight. I do not see any obvious signs of deformities, no swelling. We're going to palpate your neck. Any pain anywhere in the neck?
No.
No pain. Okay, we're going to palpate the thyroid gland and our trachea. The trachea is midline and straight. For a thyroid gland, we're going to be using our index and our middle finger and palpate on one side, and we're going to retract on the other side, right below the cricoid cartilage, which is above the supraclavicular notch. Okay, go ahead and swallow. Great. On the other side, we're going to feel and then retract. Great. Swallow. Great. On palpation, any pain or swelling that you feel?
No.
Okay, so no pain reported by the patient, no tenderness. I do not feel any masses or swelling in the thyroid gland. While here, we're going to test for cranial nerve number 11, which is the spinal accessory nerve. So I'm going to have you shrug your shoulders, okay? Go ahead and shrug your shoulders. Nice. Cranial nerve number 11, the spinal accessory nerve, is intact as the patient shrugs her shoulders bilaterally and the strength is good. While on the neck, we're going to palpate for carotid arteries. Okay. Start on the left side. Okay. And on the right side. Wait. The carotid arteries are +2 bilaterally on the left and the right side. And we're going to auscultate with the bell of a stethoscope. We're going to check for any bruise or abnormal sounds, and I'll have our patient hold her breath while we do that for a few seconds. I did not hear any bruise or abnormal sounds on auscultation. Okay, wonderful. We're going to move down to the cardiovascular aspect of our exam. We're going to be listening to our heart sounds. First, we're going to inspect our patient's chest. I see good rise and fall of the chest, and the patient is breathing it unlabored, no use of accessory muscles. And we're going to listen to the breath sounds first in 6 long fills using the diaphragm of a stethoscope. Just breathe normally. Breath sounds are clear in all long fills. No adventitious breath sounds were heard. Okay. Looking at our patient's back on inspection, it's flat and nice. No obvious signs of deformities that I can see. It looks straight and midline. We're going to be listening to breath sounds beginning at the top of the clavicles in the intercostal spaces in 8 fills, making sure we include the right middle lobe. Breath sounds are clear and equal in all long fills. No signs of adventitious breath sounds. We're going to go ahead and listen to our heart sounds, beginning with the diaphragm of a stethoscope, and then we'll use the bell of a stethoscope. Beginning with the aortic portion. in the second intercostal space on the right side. The pulmonic, second intercostal space, left sternal border. Erb's point, third intercostal space, left sternal border. The tricuspid, fourth intercostal space, left sternal border. Mitral is the fifth intercostal space, mid-clavicular. Okay. Heart sounds S1 and S2 are normal, and we're going to listen with a bell of a stethoscope for any murmurs or burrs. Beginning with the aorta, second intercostal space on the right. The pulmonic is the second intercostal space on the left sternal border. Erb's point is the third intercostal space, left sternal border. Tricuspid, fourth intercostal space, left sternal border. And the mitral, fifth intercostal space, mid-clavicular. No murmurs or breeze were heard, and these are normal findings. Okay, we're going to proceed with the upper extremity inspection. I'm looking at my patient's upper extremities. Her hand, the skin, it's dry and warm. No lesions, no open sores, no signs of wounds, no infections, no swelling noted. Okay, we're going to check for capillary fill. We're going to be using the inner aspect, the palm of our patient's hands. We're going to press down on the nape, on the bed of the fingers and release. And capillary fill is less than 3 bilaterally. We're checking the joints for any swelling or redness, any signs of inflammation, which I do not see. And while we're here, we're going to check for cerebellar coordination. I'm going to have you do a finger to thumb rapid movements like this, as fast as you can. Great. Okay, and then I'm going to have you put your hands on your leaves, on your thighs, and flip them as fast as you can. Wonderful. Cerebellar coordination is intact. And we're going to check for elbow flexion and extension. I'm going to have you flex your elbow. Great. I'm going to have you extend. Wonderful. Range of motion in the elbow is intact. I'm going to have you check for range of motion in the shoulders. So we're going to flex out the shoulder. We're going to extend the shoulder. We're going to internally rotate, externally rotate. We're going to adduct and abduct the shoulder. Range of motion in the shoulder is intact. Okay. So we're going to check for strength in the arms. I'm going to have you hold my arms and squeeze as hard as you can. Hand grip is 5 on 5 bilaterally. Right? We're going to check your radial pulses at the same time. Radial pulses are +2 bilaterally. We'll check for strength in your biceps and your triceps. I'm going to have you put your hands like this. Pull me against you. Wonderful. Pull me outward. Wonderful. Strength in biceps and triceps are +5 on 5 bilaterally. While we're here, we're going to be testing for deep tendon reflexes in the biceps. And with my mallet, I'm going to hold out our patient's hand with my thumb in the inner aspect of the antecubital fossa. And I'm going to be striking with the sharp side of my mallet. Oh, okay, one more time. Okay, sorry. Deep tendon reflexes are 2+ in the biceps. And we're going to be testing for DTRs in the knee. Locate kneecap, and we're going to, with the flat aspect of a mallet, and okay, good. DTRs are +2 in the knee. And for the Achilles, we're going to have a patient dorsiflex a little bit and with the flat side of a mallet and strike the Achilles tendon. Oh, yeah. Deep tendon reflexes are +2 in the Achilles tendon. Okay. We're going to have our patient move to the bed where we'll have her lay down. I'm going to move our camera a little closer. We're checking for, inspecting our abdomen, we're checking for contour. I see it's flat and nice. I do not feel any bulging, or I do not see any swelling, no redness. And we are going to begin by auscultating our abdomen for bowel sounds in all 4 quadrants. Right upper, right lower, left upper, left lower. Bowel sounds are normal, active in all 4 quadrants. We're going to go ahead with the bed of a stethoscope and we'll auscultate for the aortic, renal arteries, and iliac arteries. The aortic artery is located below the xiphoid process. Good. For the renal arteries, the right renal is right lateral above the umbilicus. The left renal is left lateral above the umbilicus. And the iliac arteries is below the umbilicus. For the right iliac is right lateral below the umbilicus. And the left lateral is left lateral below the umbilicus. I do not hear any abnormal bruise in the iliac, aortic, and renal arteries. We'll go ahead and percuss our abdomen. We're checking for any tympany, flatness, or dullness. Using 3 fingers and the middle finger, we're going to percuss and check for dullness. Okay. I do not feel any dullness, I do not hear any dullness, flatness, or tympany in the abdomen. We'll go ahead and palpate the abdomen in all 4 quadrants. Let me know if you feel any pain or tenderness.
No.
No pain or tenderness. Any pain or tenderness?
No.
Any pain or tenderness?
No.
Any pain or tenderness?
No.
Good. Okay. No pain or tenderness. I didn't feel any swelling, any masses in the abdomen on this exam, which is a normal finding. We'll go ahead and try to palpate the spleen. And with the spleen, I'll be using my right hand behind the patient's back and my left going at an inward and upward at the costovertebral angle to try and palpate the spleen. Okay. And then right. Any pain or tenderness?
No.
No pain, tenderness?
No.
Okay, good. I couldn't feel the spleen for this exam, which is a normal finding. And we're going to try and palpate for the liver using my left hand behind the patient and my right hand to palpate. At a costovertebral angle, inward and upward. Any pain or tenderness?
No.
Pain, tenderness?
No.
Good. I couldn't palpate the liver for this exam, which is a normal finding. And we're going to be testing for the Bloomberg sign. We'll go at a 90-degree angle and check for any rebound tenderness. Let me know if you feel any pain when I release, okay? Any pain or tenderness?
No.
Any pain or tenderness?
No.
No pain or tenderness was reported by the patient, so negative rebound tenderness, which is a normal finding for this exam. We'll go ahead and check for the lower extremities. We're looking at our patient's skin. In the lower extremities, nice and dry, no swelling, no lesions or redness. no signs of edema. The joints look normal, no signs of inflammation. We're going to check for range of motion of the hip. I'm going to have our patient bring her knee all the way to her chest. Wonderful. I'm going to have our patient externally rotate the knee like this. Good. Internally rotate the hip, sorry. Good. And we're not checking for extension for this exam. I'm going to have a patient abduct outward. Good. And then abduct. Great. Range of motion of the knee, of the hip is intact. And for the knees, I'll have you bring both of your knees to your chest. We're checking for range of motion of the knee and strength. Okay. Then push against me. Wonderful. And pull me towards you. Great. Strength in the knee is +5 bilaterally for strength. We'll go ahead and check for range of motion in the ankles. So I'm going to have you press against my hands, right, and then pull towards me. Great. And we're going to rotate the ankle, which is normal in the ankle. And we'll check for strength in the ankles bilaterally. Okay, go ahead and push on my hands like you're pressing on the great, and then pull against me. Wonderful. So strength is +5 bilaterally in the ankles. We'll go ahead and palpate for our pedal pulses. Pulse is 2+ bilaterally in the legs. Okay, I'm gonna have you go ahead and flex your ankles, dorsiflex. Good. And then extend. Wonderful. Great. You can go ahead and stand. We're going to inspect our patient's spine for symmetry, misalignments, and pain or tenderness. Any pain or tenderness?
No.
Any pain or tenderness?
No.
Pain or tenderness?
No.
Okay. No pain or tenderness reported on this exam. Okay, so we're going to check for range of motion in the spine right now. I'm going to have you touch your toes. Great. That's for flexion. I'm going to have you extend backwards. Great. I'm going to have you left lateral, so side to side. Great. On the other side, right lateral. Wonderful. Then I'm going to have you rotate and to the other side. Great. Range of motion in the spine is intact. We're going to be testing for the Rumbert test, which is to test for coordination. Here we're looking for any swaying or coordination problems. I'm going to have you close your eyes and stand at attention. We're checking to see if there's any swaying or coordination problems. Great. I did not notice any swaying by the patient or coordination problems. Romberg's test is negative, which is a normal finding. Now we're going to check for gait. I'm going to have a patient take a few steps, the front and back, and come back. Good. Range of our patient's gait is steady, no signs of swaying or unsteadiness on ambulation. Okay, any questions?
No.
Any discomfort during this exam?
No.
Okay, this concludes the assessment for NR 509 for the physical assessment video. Thank you.